Exposure reproducibility is a test to determine whether a given technique setting on an X-ray machine will consistently produce a similar amount of radiation each time the setting is used. Not enough exposure and the image will require a retake, which increases patient exposure. Too much exposure might require a retake, but certainly means unnecessary patient exposure. The only equipment needed to test reproducibility is an exposure monitoring instrument and a calculator. To perform the test, position the exposure monitoring instrument's probe near the center of the X-ray beam and at an appropriate distance from the tube. An appropriate distance would be where the patient would be located. Either midline or skin entrance would work as long as the distance remains the same throughout the test series. You should perform this reproducibility test for at least 3 different MA or MAS settings using the same kVp. Ideally, these should be across the range of MA or MAS, typically used on this X-ray machine. Here is a series of 4 exposures taken at 80 kVp, 100 MA on a small focal spot for 100 milliseconds, or a mass of 10. The average of the 4 exposures is determined by adding the 4 exposures and dividing by 4. Next, find the difference between the highest and the lowest test exposures and multiply by 12. In this case, 220 minus 213 is 7. 7 times 12 is 84, which is less than the average exposure of 216 millirem. Therefore, the 100 MA small focal spot is reproducible. The next test series is still at 80 kVp and 100 milliseconds, but now at 150 milliamps on the large focal spot. The mass is 15. The difference from the maximum to minimum exposure is 370 minus 318, or 52 millirem. 12 times 52 is 624, which exceeds the average exposure of 336. A repeat test at 80 kVp, 100 milliseconds at 150 milliamps on the large focal spot gave these results. The difference between maximum and minimum is now 19 millirem, and 12 times 19 is 228, which is less than the average of 329 millirem. Even though the 150 MA large focal spot does have one result that is too high from the first series, the second series of 4 exposures is found to be reproducible. For the third mass, at 80 kVp, we used 200 MA on a large focal spot for 100 milliseconds. The mass is 20. The first set of exposures has a difference of 60 between maximum and minimum. 12 times 60 is 720, which exceeds the average of 447, and thus these results are not reproducible. A repeat test at 80 kVp, 100 milliseconds at 200 milliamps on the large focal spot gives these results. The difference between maximum and minimum is now 56, which times 12 is 672. This still exceeds the average of 457, and therefore this mass station is not reproducible. In summary, when testing reproducibility, at least 3 different MA or MAS settings should be used. If any setting fails the first test of 4 exposures, repeat the test to confirm the non-compliance. As a radiation control program inspector, your efforts to verify that X-ray machines produce consistent exposures is part of the task of assuring patients receive the best quality image without unnecessary radiation exposure. This video has been produced by the G55 Training Committee of the Conference of Radiation Control Program Directors, Incorporated.